So let's talk about some stress reduction strategies that are helpful for us when we're working with children that are in the hospital, as well as the family members of those children in the hospital. So first of all, we like to break it down into the 3 R's, if you will. First of all, it's really important that we do everything we possibly can to maintain the relationships this child may have, whether it's with family members and allowing those family members to room in, which we do a lot in the pediatric world. For the most part, every child has somebody staying with them every night, but also including peers and siblings through all of the technology we have today. Even if they can't come in to visit, we can give them a lot of relationship support, and that's very, very important. Secondly, for children are really very much rely on routines, and it's our job as healthcare professionals to do all we can to maintain those routines when the children are in the hospital. So that's important for us to verify with family members as well. What is the normal routine this child has? How are their nightly routines kept? And what can we do to maintain those and encourage those in the hospital? Recreation and play, as we've said, play is incredibly important, and it is the work of children. It's how they learn and explore and grow and develop. That needs to continue, and in many cases we use recreation and play to not only give them some free time, but also to help them build some relationships, being in groups of other children if at all possible. And finally, children need to have rest. That is incredibly important, and in many cases why they're in the hospital is that they need that rest time. How can we minimize the stress that these kids will have? We've talked a lot about the types of stress and what they feel. Always, with every child, give control. Allow them to make choices when they can. Most importantly, do not give them an option of choice if there is no choice. So for example, we don't ask, is it okay if we do your vital signs when we have to do your vital signs? Don't ask, is it okay if I give you your medicine now when it is time to give them their medicine? Because we don't want to establish complications with trust. Where I can give them a choice. Do you want to take your bath this morning, or do you want to take your bath after you watch SpongeBob? Which would you like to have for lunch? And let them help you pick. So those are ways that we can give them those choices and help encourage independence, growth, and development at all of those stages. Therapeutic play allows children to manipulate and play with things that they may interface with in the hospital, but it also will enable them to talk about any fears and concerns that they may have. And then therapeutic recreation is also very similar, only involves a little bit more interaction. So maybe we have them playing in an environment with other people or in an environment where they can explore what they may be interfacing with. So child life is something that every certified children's hospital needs to have. These are developmental specialists whose job it is to not only maintain the normalcy of children and enhance growth and development, but also to help with children who are preparing for procedures or experiences or diagnoses using therapeutic play and developmental approaches that are best for children to use. We've actually used these guys too. Many of the child life workers will help with distraction and pain management techniques that are non-pharmacologic. If we are doing a lumbar puncture or procedures, we'll often bring them into the procedure rooms, and they'll work with the children to help them do a lot of visualization and activities. They're amazing people and really essential for children's hospitals. A lot of what child life programs you can see I have listed there will help with all of the activities that are necessary, and they really do help out nursing and medical staff to meet the needs of these kids and ensure that growth and development continues as best it possibly can under the circumstances of hospitalization. It is important to always allow hospital play, children to manipulate and play with equipment. There are a lot of times when I've had children who have maybe been in traction or casted, serial castings or things, and a lot of times child life, as well as some of these other departments, will put casts on their baby dolls, will put their teddy bear in traction, things like that that really just help children adapt and cope, but also have the ability to manipulate those types of products and those types of equipment that again gives them a sense of control and understanding. So there are some techniques for therapeutic play that child life will use, but nursing will also use. And some of those there, storytelling, so reading stories or going over stories with them about how other children have experienced different things. Using dramatic play or puppets, their special animal or toy, as I mentioned previously. Also doing drawings, pictures, paintings. Pediatric artwork is incredible. It's really fascinating to be able to see the differences in different ages, as well as the differences in what children who are chronically ill or who are dying and what their artwork can look like. It's amazing and dramatic what we may see children show through artwork and play. And something that, again, is if you're interested in, there's a lot of research out there and a lot of fascinating stuff. I've taken some classes on those things, and it's amazing to learn. Animal therapy, we all love that. We're loving that right now in our COVID status. However, animal therapy is actually really very common now, and we use it as much as possible. I think there's a commercial on TV now where somebody brings a dog into a little girl who's getting treatments. It's a cute commercial. But animal therapy of any form is really good. And sometimes it doesn't even have to be in person. They can see videos and pictures. We know that that's uplifting for all of us. And it's something that is no different with children. So these are some stress reduction strategies that we can use. For children who have a planned hospitalization, a lot of times hospitals will offer the ability for the children to come in and tour and to work with a child life specialist to learn a little bit about what they're going to experience and what they're going to feel. It gives them a chance to play with equipment. It gives them a chance to ask questions. And it at least takes away that unknown fear or fear of the unknown, I guess, in environments that they may be coming into. For children who have an unplanned hospitalization, things are obviously a little bit different. And it can be a little bit of a crisis or a concern as we get started. But once we get the ability to kind of get things to calm down, we really need to, first of all, get child life involved with the children. Usually they'll make rounds in the morning for new admissions, but also really work with the family and the child to bring them up to speed, introduce them to the unit, the routines, where things are, and to be able to encourage them to ask questions and express how they're feeling. And this is important for parents as well, especially parents of younger children. If we are concerned and feel like we need a little more intervention, we can bring in a myriad of different services that we interface with, whether it's social work or family counseling or child life or physical therapy, occupational therapy, all of those things. But without the interview that the initial nurse is doing upon admission, some of that stuff can get missed. So we have a big role in this. So finally, I just have 2 slides here that I want to talk about discharging hospitalized children, because there are some things that we need to pay attention to, because again, we're not just discharging the child, but we're discharging the caregivers as well, who have to then take responsibility for the child. So for discharge planning, we need to think about, can the family provide the care that is necessary? Now, in most cases, children are in and out of the hospital for a brief procedure, maybe a flare in asthma or gastroenteritis. While there may not be equipment that is needed, there are certainly pieces of information that families need to know, and we need to be able to trust that they're going to be able to make sure that they're able to recognize when there's complications with the child prior to discharge, so that they are able to bring that child in when it is necessary at a later date. So parent teaching is essential, and really honestly, that parent teaching needs to include all that anticipatory guidance that we've been learning about. So even though the child may have been in for an asthmatic flare, of course we need to emphasize that training and teaching. But it's also really important to talk about if that was a 5-year-old, what do the parents need to think about as that 5-year-old continues to grow and develop? So education, constantly, always thinking about that, even in little interactions in the patient's rooms, as well as the clinic anytime we get them in. And finally, when a child has a long-term condition, a chronic condition, like diabetes or sickle cell, then certainly we have to think about their ability to get back into school. Individualized education and individualized transition plans are developed in conjunction with the school nurse. And there are requirements that schools accommodate reasonably children that have special needs. In many cases, they are children that have asthma, diabetes, sickle cell, but certainly we also have those children who have profound neurologic and musculoskeletal compromise that also require those transition plans. We also need to make sure that our families are prepared. Can they handle any emergencies? Is the emergency care system prepared and aware? I know a lot of times with some of the kids we discharge, we have to make sure they live in some rural areas, and we need to make sure that EMS systems are well aware that they've got a child with special needs, so that if a call does come, they're prepared to handle a pediatric patient. Many EMS systems are not. As well as, if power goes out. We need to make sure that a lot of extra companies, fire companies, et cetera, are well aware of the needs in case that child is getting technology at home, like a ventilator, where they may need that electrical service.